Hey, this is Dr. Mark Tachinowski going to talk to you today a little bit about knee pain. So knee pain can essentially be things that you've been diagnosed with, such as patellofemoral tracking disorder. It could be, let's say, runner's knee. It could be IT band syndrome. All of these things essentially tell you that you have knee pain, but it doesn't tell you necessarily how to treat it. We've seen IT band syndromes come from a number of different sources, so they have to be treated differently. We've seen patellofemoral tracking disorders come from a number of different sources, so they have to be treated differently. So just because something is called something one way doesn't mean it's always treated the same way. We have to do our due diligence in the investigation as to what actually is firing properly and what isn't firing properly. We'll teach you how to use your body more efficiently so that way the pain reduces. So typical knee presentation we'll go through patellofemoral tracking disorder. That's a good one. So that's essentially where the patella is tracking too far laterally because they think it's a patella issue, but it's not. What they used to do for that is they used to do something called a lateral release, which is a pretty barbaric surgery, and I think it was probably one of the least successful surgeries in the history of surgery. But what we do for patellofemoral tracking is we take the femur and we're going to teach the femur how to rotate laterally more by firing muscles that are in the hip, like the external rotators and the glute medius and the glute minimus. Then from the bottom side of things, we're going to make sure that that foot doesn't overpronate, that you know how to use your supination muscles, that you're not falling into pronation, slapping into pronation because you can't control those things well. So we attack it from the bottom and we attack it from the top, but most of the time we rarely see a knee problem. Occasionally we will see a popliteus issue, which is a muscle that sits right in the back of the knee. But again, most times when we're looking at a knee problem, we need to investigate above the issue and below the issue. So we typically look at your pronation supination and we typically look at your glute stabilization. So that's pretty much how we attack a knee.